Hi there, welcome to this video series on coronavirus, hoping for the best and preparing for the worst. This is a series aimed at frail and vulnerable people who might otherwise be anxious about the virus and what it might do to them. I'm a doctor in Oxford in the UK. I'm a family practitioner or GP, but also a palliative care doctor, mainly for children, but also for adults. I've been doing these for 25 years, so I've got a lot of experience, which I hope I can use helpfully during this coronavirus outbreak. I'm currently sitting at home, isolated, recovering from the coronavirus myself, which for me, fortunately, has been just a mild illness. But I know, although it will be mild for most people, there's a tremendous amount of anxiety out there, particularly for people who are living alone and worried about getting sick or even dying, but without their family. I want these videos to be comforting because the fact of the matter is the vast majority of people are not going to suffer significantly with this. But even for those who do go on to get really poorly and maybe die, even more importantly, I want these episodes and series to be comfortable, comforting rather. So I want this series to be a really practical guide and comforting, but honest, talking about coronavirus. In the series, I'm going to be telling it straight and gently. I'll try and do it as comfortingly as I can, but above all, I will be honest, so you have the chance to make your own decisions and decide what you want to do. In the series of videos, there will be 6. In the first, I'll talk about what corona does to your body, if you get it mildly, if you get it severely, and if you get it badly enough that it can kill you. In the second episode, I'll be talking about some facts and figures, which might sound a little bit boring, but are actually really, really important, because unless you know what the facts and the figures are, it's very difficult for you to make an informed choice about the care you want. It's very easy to get overly anxious about what might happen to you when you don't need to be. And it's also quite easy to put your head in the sand and not make key choices while you're still able to do so for yourself. In the third video, I'll be talking about where your options are to be cared for, where you'd like to be cared for, if that's possible, where you live. In the fourth episode, I'll be talking about death and dying itself, which is never an easy topic, but I can guarantee you that although you may feel like that's the last thing you want to be watching at the moment, that if you're feeling even slightly anxious about the possibility of dying as a result of coronavirus, you will find this episode helpful and comforting, because almost always people's fears are much greater than the reality of what happens. And then I will move on to the 5th video about planning, telling you about how you can plan for your care for if you get sick, if you get very sick, and even if you die, because care planning is the most crucial thing you can do to make sure you give yourself the best chance of surviving, and also that you get the best chance of being looked after properly if you get sick, and deciding about where you want to be should you die from the illness. And in the final video, really more aimed at people talking about death and dying. This might be loved ones and family and friends, but also professionals and carers, because in my experience, a lot of people don't have these conversations because death is a taboo. We feel awkward talking about it, and therefore we avoid the conversations. But when we avoid conversations, we store up trouble for the future, whereas talking allows things to get out in the open, and then we can plan. So I hope you enjoy these videos. I hope you find them comforting. Please do go ahead and watch all of the different videos in my series. Remember, what we're doing here is hoping for the best, and for the vast majority of us, the best is what will happen, but we're also preparing for the worst, which is key. Please, please, please share these videos with your family and friends. We want these out as widely as possible, as quickly as possible, because the epidemic is spreading fast and people need to make decisions fairly quickly, really in the next couple of weeks, if they're going to be effective. Anyway, take care, and I look forward to seeing you in the next video.